Okay, well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada, and I help people with joint pain become pain-free and people with autoimmune disease get the immune system back on track. I have a special guest for you today, and I know you hear me say that all the time, but Dr. Diana Girnita is the bomb. She has a DPC direct-to-patient care practice, and she has an amazing show. She is the founder and CEO of Rheumatology On Call. If you just put that in Facebook, you will see just the amazing work that she's done dedicated to patients. So she is a leader in the space of rheumatology. She actively sees patients in the United States. I think she has licenses in gazillions of states. I will let her tell us this. And so she has an extensive background. She has a PhD in immunology, a postdoc fellow at Harvard University, immunology fellow at University of Pittsburgh. We must have kind of overlapped at University of Pittsburgh, and rheumatology fellowship where I was born in University of Cincinnati. So Dr. Grinata, welcome to the show. Tell us a little bit about your practice and how you help people.
Thank you so much, Dr. Dada. I feel honored to be here. My practice is primarily a telemedicine practice. It's called Rheumatologist on Call. I started to put the basis of this practice in 2019, and very early in 2020, I started to see patients, initially in 3 states, like you said, but then I expanded in 8 states, 9 states. So the scope of this practice was to help patients get to a rheumatologist quicker, because as you know, our patients, most of the time, they have to wait between 4 and 6 months to see a specialist like us. That was the initial thought, how to help patients reach out to the rheumatologist, to a specialist sooner. The second thought that I had was how to make the life easier for my patients, and especially patients that don't have insurance, or they have insurance with high premiums, or they have insurance but they don't have access. So because of that, I built up probably the first direct specialty care clinic in the United States for rheumatology. And then later on, I figured out there were other specialists that were doing something similar to what I offer. I'm meaning a direct interaction, a direct contact with the patient without fussing and, without welcoming the patient with just asking, what is your insurance? Or where is your insurance card? Let's check your insurance. So I wanted to remove these kind of barriers. And by removing that, I was able to access and direct contract with laboratory services that offer incredible prices, cash prices for my patients. So patients, they don't have to take that, but if they need it, they have the opportunity. And the other thing that I wanted to bring in my practice was to unite 2 worlds, the lifestyle medicine and also the traditional medicine, but we'll talk about that later.
I love that. Wow. So, you are going, so Dr. Grinita is going over and beyond the call of duty. So not only is she providing flexible care so you can get your treatment from home or wherever you are, but also she's taking the next step, which is so important because we run a lot of expensive blood tests in rheumatology. So you've already contracted with labs to say that, hey, if my patient comes, this is the cash price that you
Correct.
get. And so it's a win-win-win for everybody, right? The patient wins and the lab wins because they don't have to wait for insurance to pay them. They get their money on the spot. So great job with that thoughtfulness and negotiation on behalf of our patients. That is very smart. Thank you for that. Okay, so today we are going to talk about rheumatoid arthritis, something that Dr. Grinita is an expert at. And so could you tell us just what is rheumatoid arthritis and how does it differ from the other kinds of arthritis, right?
So I'm passionate about rheumatoid arthritis. In our field, probably every single one has a passion. They find themselves very comfortable when they assess a patient and they treat the patient. So my passion is rheumatoid arthritis. And I have collected over the years thousands of patients with this disease, not as a trophy, but as a testimony of my passion and expertise. Now, rheumatoid arthritis is an autoimmune disease, meaning that at some point in life, your immune system tries to attack something and doesn't know where to stop. And at that point, it starts attacking your own body. And most of the time, patients will come to us because of joint pain. But the inflammation that is happening in their body is more than joints. But that's what they, the pain and the swollen joints, the fact that they cannot use their hands or they cannot get out of bed, it's going to trigger that thought, oh, I need to see a specialist, or I need to see my primary care physician, who further on will send the patient to us. But in terms of symptoms, usually rheumatoid arthritis has usually, and I say usually because that's what we see most of the time, has this symmetric pattern. It's going to involve both hands, both feet, both knees, both shoulders. And, that pattern and the location of the swelling, it's very specific to rheumatoid arthritis. Not only that, but it gives you this morning stiffness. And that's something specific because a lot of patients will be confused between osteoarthritis, or the wear and tear arthritis, and the rheumatoid arthritis. So if you have severe morning stiffness, if that stiffness goes on and on for an hour or more than that, but it is improved by movement, think about rheumatoid arthritis as well. There are also a lot of other symptoms that people do not even think that they are correlated with rheumatoid arthritis. And I'm going to give you one example that I've seen so many times, like both hands carpal tunnel. This is so
Yes.
common
Yes.
that I have seen
Yes.
patients having surgery on one hand, and then surgery on the second hand, and then again on the right hand again. So when you have bilateral carpal tunnel and you don't do, or you don't use your both hands, think about rheumatoid arthritis or fatigue. A lot of patients will come to me with extreme fatigue, or dryness of the eyes, dryness of the mouth,
Yes.
and the list can
Yes.
continue, but I'll stop here.
No, that's very important. And you're right, actually, that bilateral, having carpal tunnel on both hands. Yes, that is usually, yeah, but when you've been visiting the hand surgeon pretty frequently, that's usually kind of my heads up that, hey, we're probably dealing with something more systemic. Thank you. That's actually very helpful. How would you diagnose rheumatoid arthritis in a patient? Could you share?
Yes, of course. Rheumatoid arthritis, it's a clinical diagnosis. And I know it sounds fancy, but it means that you have to listen to the patient. The symptoms that the patient have are so much more important. And then the physical exam, look at how the joints are affected, which joints are affected. So all these clinical clues are very important when you make the diagnosis. The next step is the duration of the symptoms. How long did they lasted? Did they start last week, or did they start a year ago? Because usually in our criteria, we think about rheumatoid arthritis if those symptoms last for more than 6 weeks. And then we have lab work, okay? We are very good about, as rheumatologists, we are the experts in ordering tons of blood work. And most of the time, we're going to order a panel of regular blood work, which can give us clues for inflammation, like, something like anemia, or a ferritin that is high, or your platelets are very high. That means that you have some sort of inflammation. And then we order markers of inflammation like sedimentation rate, C-reactive protein, but they are not always high. So that can confuse a lot of doctors. So once again, coming back to the clinical symptoms, and then what we are famous for, the rheumatoid factor and the
Mm,
anti-CCP antibody. So
mm, mm.
these are the two blood work that we use all the time to diagnose people with rheumatoid arthritis. But guess what? Not even those are perfect, because 60 to 70% of patients with rheumatoid arthritis, they have a positive rheumatoid factor, but others do not. Or 60% of patients, they have an anti-CCP antibody, but others they don't have that. If you have both of these markers positive, then the likelihood is that you have rheumatoid arthritis. But if they are not, and that's the case of 20% of patients with rheumatoid arthritis, they don't have anything positive. They don't have markers of inflammation high. They don't have rheumatoid factor. They don't have anti-CCP. So those patients are very hard to diagnose. So that's why it's important to sit down, talk to the patient, assess the patient, and maybe you need a couple of visits to understand what's going on. But you still have to remain in contact with your patients and try to understand them and try to help
That's
them.
that is so important, that it is kind of listening to the patient, getting that full history, and understanding that when you're talking to your doctor on day one, the diagnosis is unlikely to be clear. There are a few patients that you walk in, you shake their hand, you know what the diagnosis is, because you can feel the inflammation. But a lot of times we need the blood test and the X-rays, just like Dr.
Correct.
Grinita has said. Question about the blood test, you know it's coming, right? Rheumatoid factor, right? You know, the number of patients that you've seen, I'm sure, who have a positive rheumatoid factor, but you don't think they have rheumatoid arthritis.
Oh,
Tell us
that's
more.
Oh, I love that because actually, as you do, and as you try to educate your patients, and you have a room, and you have a YouTube channel, I have a YouTube channel where I talk about all these things that people are confused about. Rheumatoid factor is just a test, is not making a diagnosis. I would start there. Rheumatoid factor can be high in multiple other conditions, and besides rheumatoid arthritis, where people find this association so common because of the name, probably, rheumatoid factor, rheumatoid arthritis, rheumatoid factor can be elevated in other diseases, autoimmune diseases like lupus, Sjogren, and especially Sjogren. A lot of patients with Sjogren disease could have rheumatoid factor high. Could be seen in other autoimmune diseases, even thyroid disease. I found it in people with autoimmune thyroiditis,
Yeah.
but can also be found in infections like hepatitis B, hepatitis C. Those are very common to cause a rheumatoid factor that is high. And, rare, but it could be seen in cancers or lymphoma. And I have seen it even in normal people, like 4 or 5% of normal people, they will have a positive rheumatoid factor, but that doesn't mean that you have rheumatoid arthritis.
Well said. I have nothing to add to that. I think very, very thorough in knowing that you could be normal and you can have a rheumatoid factor, but still worth getting checked out just to make sure we're not missing anything on the line. I have nothing to add to that beautiful summary. Okay. So the next thing is how do we did we go through? I think we touched on diagnosis a little bit.
Yeah.
Is there anything else that we can add to
Yes.
the diagnosis?
Yes, I would definitely look into X-rays. I would order an MRI if I'm still looking for signs of inflammation. So those are things that I will assess the patient and then decide what kind of X-rays do I need. Because if you have rheumatoid arthritis for the last 2 to 3 months, X-rays is not going to help me. Maybe an MRI will, but X-rays will not. Because what I tell patients most of the time, if you don't have damage or erosions, and they develop usually after 2 years of disease, then X-rays is not going to be helpful. I know insurance companies want that, but
Yes.
unfortunately, we know that they are not helpful.
Yeah.
The other thing that I want to make sure when I make a diagnosis is that I'm not missing something else. Like I said, infections are
Yes.
notorious for causing signs or symptoms that they look like rheumatoid arthritis. And I'm going to
Yes.
mention parvovirus. You have a
Yes.
young child in the house,
Yes.
goes to the daycare, he
Yes.
can get you some parvovirus home.
Yes.
Or if you got a blood transfusion, think
Yeah.
about hepatitis B. If you change your sexual partner, think about hepatitis C or HIV. So you have to make
Yes.
sure that you don't miss that. Many times when I want to make sure, I will order a serum electrophoresis because
Yes.
that test will be more thorough to diagnose a
Yes.
hidden
Yes.
hidden
Yes.
lymphoma or multiple
Yes.
myeloma or a
Yes.
cancer. So we do have to assess all the organs, all the symptoms, and not focus on the joints.
Yeah, so true, so true. I actually have an example of that parvovirus infection. So usually those are the parvovirus infection. Usually they're like children, I would say 5 to 10-ish, and they come in with this red cheek. Called a slapped cheek appearance, but the cheeks are red on both sides. And so it's very mild on the child, but the parents can develop an arthritis that kind of looks like rheumatoid arthritis. So I do ask patients that, hey, do you have a sick child at home? And then you find out, yes, they have this parvovirus. Patient doesn't even know that it's parvovirus. Yeah, my child is sick. His face is like beet red, like strawberry red. I'm like, yeah, he has parvovirus, and so do you. Right. So thank you for that reminder for our patients too. So when your doctor is asking you some of these questions, so important to kind of give a full history so that they know, how best to address your concerns. Thank you. Okay, so treatment for rheumatoid arthritis, right? I think our patients are scared about the
Correct.
medications that we use. And so tell me how you address this. What are the treatment options? I tell our patients, I'm like, in the history of humanity, if you're going to get rheumatoid arthritis, it's now because we have so many options for patients. So I am going to let Dr. Girnita tell us what are the treatment options and how do we help patients to understand the benefits.
Do we have a full hour to talk about this?
But of course.
I have to start by saying that it is so important for patients to know their options. And like you said, if I had to have an autoimmune disease, I would tell my patients, rheumatoid arthritis, I would choose that one. If God will allow me to choose something, I will choose that one. Of course, God doesn't ask us, but if we have to think about what we have achieved in our understanding of the immune system, we have achieved so much in terms of the research that we put into rheumatoid arthritis. There is no other autoimmune disease, none, that has so many options to treat. And like you, I encourage my patients to listen, to understand, to put in a balance, the risk and the benefits. Because even if you don't care, and that's what I say to my young patients, if you don't care how the joints will look in 10 years, you will care if you're going to develop a lung disease and you cannot breathe and you cannot do your activities. But you're going to care if you have a heart disease or a heart attack. If you start at the age of 30 to be diagnosed with rheumatoid arthritis, then at 40 or 50, if you don't treat that disease, it will cause complications. It will increase your risk for heart attacks. It will increase your risk for heart failure. So I don't want to scare my patients, but I want to give them the full perspective. If you treat, what's going to happen? If you don't treat, what's going to happen? Many patients, unfortunately, they go on these support groups, so-called support groups on Facebook, on social media. They listen to people that don't treat this disease. And this is bad because there are a lot of autoimmune experts out there that they guide the patients in the wrong direction. And I tell patients, try to listen to your doctor. Of course, you can incorporate a lot of other options into your lifestyle that will be absolutely crucial, but think about medication. Don't be afraid, because if you are in constant communication with your doctor and something happens, you can address that. But if you don't treat it, the complications will be very bad. I am gonna release a book. I'm working actively on a book about rheumatoid arthritis because I said it's my passion, where I bridge these two worlds, because it's too much information on our side. On the scientific side, we are booming with information from the research community, but there is also research in the lifestyle community. And just last year, I'm talking about this for 10 years, about lifestyle and combining lifestyle for patients with rheumatoid arthritis. But just last year, the American Congress of Rheumatology had a whole session about lifestyle into rheumatoid arthritis, and then they released the guidelines for rheumatoid arthritis. And they do advise patients to combine those two words. So I'm excited to release that book.
Oh, it's gonna be fantastic. Please, when you do have that book, we're gonna have to have you on because I think this is a massive, a really helpful service for our patients. So thank you for this hard work.
Thank you.
Okay.
And I'll tell you about the treatment. So we have different types of treatments, and I know you are the expert, you can educate your patients, but I tell my patients, you never go to jump on the big guns. You start with something that might be, not so aggressive. And if that doesn't work, then we're gonna use the big guns, because what is happening today, they see all these beautiful advertisements on the TV where people are running and they feel great and they are laughing. But it's not always like that. So we want to get there, but we want to get there on a safer path.
Yeah. Thank you for that. Yeah. So I mean, so many approaches, right? But integrating the kind of modern scientific and also kind of meeting patients where they are. So
Correct.
exactly what you said is that we want to start and see kind of we don't want to overshoot the treatment, but we want to start and we make sure that we're meeting that inflammation head on, and whether we're using both the anti-inflammatory approach, using integrative medication, integrating approach, in addition to medications, and finding a balance depending on what each patient needs. So as we're thinking integrative approach, you are the expert on this. So can you tell us why an integrative approach is important in managing rheumatoid arthritis?
Sure. There are multiple layers or multiple pillars that we need to address with our patients, and not all the times we have, we have the ability or the knowledge, because in medical school and in our fellowship, we are very well taught how to recognize, diagnose, and treat with medication. So in a way, integrative medicine becomes a passion for many of us, like you, like me, and like other rheumatologists that I know. And interestingly, a lot of rheumatologists, they have this approach. It's just the time and how you present that to the patient. Because if you dump all the information at once, the patients get confused, get scared. Oh my God, I have to change all my life. This is going to be dramatic. But if you deliver information to the patient in a more structured way, first, I'll give you my example, how I approach it. I stabilize the patient in terms of inflammation, because that's the most important thing. I talk to them about medication. I put them on medication. They are stabilized. And when they feel good, they don't have pain, they don't have so much pain, their life starts to become normal again, then I start talking about lifestyle. And I'll break it down into a couple of components. One is nutrition. Nutrition is very important, because what we eat is what we are. What we put in our body will inflame us or not, will change our gut or not. And I can talk about gut, another hour. So nutrition is one, and what we eat is very important, but what we don't eat, it's also important. So incorporating certain foods into our diet can become very powerful for managing rheumatoid arthritis. Number two, I think that not many of us, we think about the connection between the mind and the body. And this is extremely important, because if you are stressed, if you're anxious, your body will respond to that with more pain. So more stress causes more pain, and more pain causes more stress. So you have to cut that connection or disconnect them to make you feel better. The other thing is exercise. A lot of people think about exercise, especially in the beginning, that, oh, my joints are hurting. Now, if I do more exercise, it's going to hurt more.
More pain.
It will hurt a little bit more, but it's going to maintain the function of your joints. It's going to boost your energy. It's going to maintain that flexibility of your joints, and it is decreasing inflammation. There is a bunch of research that is showing how exercise is helping patients with rheumatoid arthritis. And the fourth thing is sleep. I talk to my patients about sleep. How much do you sleep? Are you very careful about your sleep schedule? Because less sleep equals more pain. More
Yeah.
pain equals less sleep. So
Yes.
again, you have to kind of tackle those from multiple angles to improve your lifestyle and eventually feel better with rheumatoid arthritis.
Thank you. Thank you so much for that. You know, every time I have a patient that they're just kind of in support of what you mentioned about sleep, right? Every time I have a patient and I start going into the sleep, you can see that they already know where I'm going, right? And they're like, I don't want to use CPAP. They're like, I'm like, I'm like, I am just asking us to evaluate and determine if we need what's going on with your sleep, right? And there's so many reasons why people have non-restorative sleep. Obstructive
Correct.
sleep apnea, which needs CPAP, is just one of them. But their eyes start to open. They think about the fact that it doesn't look good when they're sleeping with a mask, and they're just not happy. It's always a little bit of encouragement that they need. Let's investigate, find out if you have a sleep issue, because exactly what you said, the less sleep you have, the less good quality sleep you have, the more pain you have. So thank you for actually bringing that up. I'm going to make sure my patients listen to this episode so that when we're talking about sleep, like, oh no, she wants to put me on CPAP. So
Yeah.
thank you. That's so helpful. I love that approach. And because I think at the end of the day, we want our patients to win. Right. So, okay. And then can you share a story of a patient who had an amazing outcome after the benefit of being in your care?
I have many patients. Actually, in the book that I'm going to release, I share a lot of my patient stories and how we started, where we started, and how we progressed towards this integrative approach and what did they achieve from that. And I can tell you one story that kind of sticks with me. I had a patient that was on medication for about 2 to 3 years. He was doing well, but he was keep coming back and he was telling me, doc, I'm so fatigued. I don't know what to do. And I tried to see, does he have anemia? No. Does he sleeps well? He was sleeping, quite well. Does he exercise? Yes, he was exercising. So he was a young kind of guy that he was always busy, always running from meeting to meeting. But he was complaining about fatigue. Joint-wise, he was perfect. He had no complaints in his joints, but the fatigue. So I started to ask him, so can you sit down and for the next 2 weeks, write me down what you are eating, what you are drinking, what you are doing in terms of nutrition every single day. And he did wrote it down. He sent me about 5, 6 pages of all the things that he was eating and drinking. And what I've noticed is that every single meal he had a can of soda. Every
Mm,
single meal he was not
mm,
drinking any water. So
mm,
during his next appointment, I
mm,
asked him, so how much water do you drink? And he said,
mm,
I don't really drink water, but I do hydrate
mhm.
myself. I drink
Yes.
my pop every day, with every
Yes.
meal, and I
Yes. It's
also
liquid.
yes, it's liquid, and I have, sweetened tea, and I have this, and I
Mm,
have
mm,
that.
mm, mm,
But it was
mm,
always a can of soda with every
mm,
single meal.
mm,
So I said to him, I think that you are drinking, and he was eating quite good, but the drinking part was kind of interesting. So I said to him, I think you should start removing the soda that you are drinking every
yeah.
single day. And it was hard for him because he was used to this for many years. So I kind of, walked him through the process. I said, okay, this week you're going to have, instead of every single meal you're going to have was one meal, and the rest you will replace with water. And the next week you're going to have, instead of 5 cans, you're going to have 3. And the next week you're going to have 2. And the next week you're going to have 1. Guess what? In 3 months, he was free of soda. He was drinking a lot of mineral water because he
She
liked the
likes the
bubbles.
bubbly. Yeah, the
Yes,
bubbles. Yes.
he likes the bubble,
Yeah.
and he was drinking water and unsweetened tea. And I
Yeah.
asked him, do your tea at home. Don't buy the
Yes.
tea,
Yes.
in the store.
Yes.
So he came to me and he said, you know what? I'm like a new man. I cannot believe
Wow.
I have so
Wow.
much energy and I don't need the pop. I was using the pop because I thought that will give me energy to go through
Energy.
my meetings
Yes.
and to go
Yeah.
through my day. So that's
Yeah.
one example about
That's
how
a very good. Yes.
removing
Yes.
sugar can bring your energy
Yes.
back.
Yes, isn't that something, right? He was trying to solve a problem, right? Kind of felt that he didn't have a lot of energy, started using some of the caffeine in pop, I'm sure, right? So
Yes.
as a stimulant, right? He was trying to self-medicate without realizing it, then got hooked on the sugar part, which is not really what he wanted. And that on the other hand resulted in being pro-inflammatory. So wow, that's a lot of work, right? So working with your patients and I think that's what kind of separates us, right? In terms of, the caring for the patient and taking the time with the patient to identify that, oh, this is a trigger. And I think that's something you and I do very well. Spending that time with the patients, getting to really understand what is it in their lifestyle that is impacting their income, identifying it, removing it, and helping patients get a big win. Thank you so much. So we have come to, you and I can just keep talking, right? But
Yes.
but we are going to let our audience go. But prior to that, I want to ask Dr. Dina Girnata, how can patients find you? How do they work with you? How do they find you? How do they follow you?
So my patients will find me very easily on the social media. I have a YouTube channel. It's called Rheumatologist on Call, or you just Google my name, Diana Grinita. I know my name is very difficult, but if you will look up for Rheumatologist on Call, you're going to find my YouTube channel. And then I have an Instagram account with the same name, Rheumatologist on Call, and a Facebook account. I do host a Facebook group. It's called Rheumatoid Arthritis Warriors, where there are about 20,000 people there with rheumatoid arthritis. And I do teach them about lifestyle and about the truth about medications, because a lot of patients, like you said, they are afraid of medication. But if they want to become our patients, we do see patients. So my company is called Rheumatologist on Call, and we do see patients actively right now in 8 states. Our plan is to actually expand in more states. We do see patients in California, in Arizona, in Texas, in Florida, Indiana, Kentucky, Ohio, and then we plan to expand in a few other states soon. But you can look up at my website, rheumatologistoncall.com, or you can call our office at 650-525-4404, and we will take care of you. We will help you from the comfort of your home, or you can come to my office in Irvine, California, where I do see patients in person.
Okay, wonderful. So, Dr. Grinata, and then of course we have books coming out. So we're definitely going to have you back on this show. So for everybody, thank you so much for listening. If you think this video is helpful, do share it. Do subscribe to Healthy Joints, Healthy Lifestyle Show, and we will see you again during that next interview. Thank you so much, Dr. Grinata. Bye, everybody.
Thank you.